So we're going to pay it, right? Going. Good evening, everybody. I'm Arshad Hussain Mamun, and I welcome all of you to Bangladeshi Americans for Biden-Harris Facebook group's first fundraising event tonight with Donna Imam, the Texas 31 Democratic nominee for U.S. Congress. Thank you, Donna, for joining us tonight. We are glad that you are here.
Thank you so much for having me, and hello to everybody who's tuning in right now.
Thank you. Rokan Ahmed, Taj Ghaznavi, and Tuhin Mahmoud from our group are also with me, and all of us will be moderating this event. And we are sure it's going to be an exciting evening. Our group is a national platform of Bangladeshi Americans who came together to elect Biden and Harris to White House and progressive Democratic candidates everywhere in the United States. We have 3,200 strong members. We are organizing, volunteering, phone banking, texting. In fact, in the last few days, we have been among top 5 nationwide, the people who are texting for Biden campaign. So that is a remarkable achievement for our members, and we are proud of that. We are inviting local and national politicians in get out of the events, and of course fundraising, especially for our own people like Donna and Nina in Pennsylvania, who are running for public office in 2020. So tonight we are raising funds for Donna Imam. This is the end of the month and end of quarter. The election is like 5 weeks from now. So it's busy time for the campaign, and I'm glad Donna was able to join with us. I'm also glad to report that we have already raised more than $5,000 for Donna from our group. So 55 donors from 14 different states with an average donation of about $90. That's a good number, but we can do better. We have 3,200 people. If we can $10 a piece, that's like few times of what we raise. So we are expecting that some of our members will be listening tonight to Donna, will be more excited about her candidacy and contribute even more. So let me thank all of our members, friends, and families who contributed. Your support is commendable and appreciated. For folks who could not have done it before, we attached a donation link of Donna's campaign in our Facebook Live. So while you are listening, please feel free to click that button, call your friends and families, and ask them donate, and you also donate by yourself. Again, as we said, even if it's $10, $20, it's snowball to a big number since our member numbers is pretty big. And the one other thing, folks who are watching, please feel free to comment or submit your question in the form of comment, and we'll collect those questions, and at the end of the program, we'll ask Donna and get answer for you. So as promised in our donation page, that will now recognize our donors of different categories by name. Let me go to Rokan first, and then Taj second for that.
So we would like to first acknowledge the most generous contributors to Donna's campaign for this fundraiser. At the highest level, we have two people who made it to the category of Friends of Donna, who contributed at least $500. So they are Mofazal Chaudhry and Abu Hassan. Thank you so very much to both of you. Next, we have Donna's champions who contributed at least $250. So they are Sarwar Shikdar, Raunak Iman, Tuhin Mahmood, Muhammad Arshad Hussain Mamun, Arshad Mansoor, and Chanchal Banerjee. So we greatly appreciate you opening up your heart and your wallet for this trailblazing campaign. Thank you so very much. Taz?
I'd like to thank a few more of our wonderful donors who contributed at the level of Donna supporters, which is $100, and Donna advocates, which is $50. And at the Donna supporters, we have Sharfaraz Khan, ABN Rahman, Rokon Ahmed, Mahmoud Hassan, Shamima Banu, Shujat Jamil, Muhammad Chaudhry, Hassan Ahmed, Amir Hussain, Aziz Ahmed, Mustaqur Sharkar, Saeed Rahman, Shibgat Chaudhry, Humayun Kobir, R. Naz. And at Donna advocate level, we have Shafat Ahmed, Muhammad Chaudhry, Abdullah Daud, Shabab Hussain, Uchala Chaudhry, Naza Hussain, Muhammad Maula, Javed Iqbal, A.K.M. Nawaz, Nasima Rahman, Biplab Ghosh, Kamrul Hakim, Zahidul Siddiqui, Rashid Islam, ABM Nasir, Ali Akand. Thank you all very much for your donation.
Thank you, Rokan, and thank you, Taj. As we are on the thank yous, I would like to acknowledge a couple of folks specifically. Sarwar Sikdar from Dallas, he is one of our group admin and a dear friend who made very significant contribution in raising funds through his friends and family. So I know you are listening, Sarwar. A very special thank you to you. I really appreciate your effort. And one more person I'd like to thank is Lily Rodriguez. She is staff on Donna's campaign. She has been very collaborative up until the very last moment, and we bugged her on so many issues for so many times, and she was always responsive. So thank you, Lily, if you are listening. So let's go to Tuhin Mahmood, for introducing Donna Imam formally to our event. Tuhin.
Okay. Yeah, so it's a pleasure to introduce Donna Imam. Is running for U.S. Congress as Democratic nominee to represent the good people of Texas, 31 congressional district, covering all of Williamson County, northern part of Bell County. She is computer engineer and tech entrepreneur who brings a proven track record of solving complex problems to address the needs of her constituency. Donna earned her master's degree in computer engineering from Purdue University in Indiana and worked for large corporations like Siemens and Dell. She is a hardworking grassroots campaigner who defeated 11 candidates in the primary to become the Democratic nominee. Senator Bernie Sanders, Senator Elizabeth Warren, ex-Democratic presidential candidate Andrew Yang, Beto O'Rourke, Julian Castro, all have endorsed Donna's candidacy. We are proud of the fact that Donna happens to be a Bangladeshi descendant. Welcome, Donna, to our fundraising event. And thanks again for joining us tonight. We're proud of your candidacy and optimistic that you can finally turn Texas 31 blue. Thank you.
Thank you so much. I love the enthusiasm from the Bangladeshi Americans for Biden-Harris. What a group. Thank you so much. And so many names all across this country. It is amazing that you've come together. You have no idea how grateful I am and so excited to hear that you are on board our campaign here in Texas. I'm truly grateful, and thanks for putting this together.
Thank you, Donna. So we have a campaign, a video clip from your campaign, and I've tried to play it, and I did try it before. It looks good, so let me try in share screen. Okay.
We don't have any audio, just so you know.
Okay, so the audio is not coming across what it did before. So maybe we'll skip then.
You can share it on your Facebook page or something like that.
Okay, we'll share it later. Thank you. All right, so I would like to acknowledge one thing. I know our folks from different part of the country, I mean, they think about Texas and they believe like it's all red state, so I'd like to acknowledge a couple of things and make some correction of perception, if you will, So Donna is more qualified than her opponent in merit, in education, in qualification, no doubt about this. And then I'm a voter for Donna, so we are going to vote, few of us from our home. I live in Round Rock, and I know she is on merit a better candidate. She knows her constituency. I read somewhere Donna saying that I know people in my district better than anybody else. I know who lives where, what they do, what their needs are, and my policies are based on my understanding of my constituency. That's a powerful statement for a candidate who is close to her people. So on merit, she is by far a better candidate. And we support Democrat and progressive, and that is enough for us to support her. But on the top of that, I know we are extra excited. The entire country is excited about Donna's candidacy, and it's just a simple thing. We see a reflection of us in Donna. So she's among us. She's one of us. And those of us have young children tonight, 5, 10, 15, 20-year-old. If you look at their faces and imagine 20 years down the road, I hope you see Donna. So we need to create good role model, good example in our community, so that we can tell our daughters that you can do anything in this country, including running for office and win. So she is not running just for running. She is here to win it. And to win, we need two things. We need vote and we need funds. It's a little bit unfortunate that campaigns and candidates have to spend this much time to raise funds. But the reality of the country is 80% of the time, the campaign raise most money, end up winning the race. So it's a necessity. And I know all of us cannot vote from other states, but you have friends and families, in Round Rock, in Georgetown, in Killeen, In Taylor and Temple, please call your friends and family and ask them to support Donna. But all of us can donate money, right? So that part is easy. So again, the link is there. Please feel free to click that button and donate if you have not done it before. Now we are moving to the next stage of our next segment of our program, which is a panel discussion that Rokon Ahmed, Tuhin Mahmood, and Taj will conduct mostly. So let's start with Tuhin. Tuhin, go ahead, please.
Hi, Donna. This is Tuhin Mahmood again. I'm in Austin, Texas. Can you hear me?
Yes, go ahead, please.
Okay. Yeah. Hi, Donna. This is Tuhin Mahmood. I'm from Austin, Texas. I'm not a direct voter for you, but I'm rooting for you all the way. So my first question for you is, your performance in a Democratic primary Texas 31 was very impressive. You became Democratic nominee by winning a runoff election. Being a completely new candidate in this district, what do you think are the main reasons for your campaign success, and how will you carry it in the general election?
Thank you. That's a great question, and I really, really appreciate it. So, as you guys have heard, there were a dozen candidates in this Democratic primary, and on March 3rd, we advanced to the runoff. And after advancing to the runoff, we advanced to the runoff, and then after advancing to the runoff, we won that runoff. So how did we do it, right? Because our campaign was up against other people who had ran before, who had ran district-wide, and up against other elected officials. And I'm a first-time candidate that has never, ever ran for office. So what we attribute our success is focusing on the people in this district. So Mr. Mamoon just, iterated word for word almost something out of a news article, a quote that I had given about knowing the people in my district. And I'm amazed that he caught on to that, because what I was trying to tell the people of this district and the journalists who were interviewing me, this was back in February before the primary, is that I quit my job in January 2019, and I spent 6 months researching this district, listening to nonpartisan voters, partisan voters, Democrats, moms groups, Lions clubs, Rotary clubs, anyone who would talk to me and tell me what their challenges were, middle class, lower middle class, upper middle class, to try to understand what were the challenges, what would motivate people to come out and vote, and what were the things that they were struggling with on a day-to-day basis. So I attribute our success to 2 things. One, we have the right message, the message that resonates with the people in our district. And number 2, we were able to get our message to voters, to get them excited to come out. So not only were we talking to the issues that they're facing on a day-to-day basis, we were able to reach them. And so those 2 things, I believe, got us there. And what I like to say to my campaign is, people love our message. If we can get our message to voters, we win, hands down.
The next question goes to Rokon.
So hi, Donna. My name is Rokon Ahmed. Although I live all the way up in New Hampshire, I have been actually following your campaign closely. So I would like to follow up on your career path. Some of us are engineers here, so I can basically relate to you. But we don't really have that many engineers in politics. Only about 10 congressmen and 1 senator that I know of are currently serving. So do you think it's harder for you to make your case to be a lawmaker in politics if you're not a lawyer or a business owner or a game show host? Or do you see an edge with your background here?
No, I think, as an engineer that has led some of the most successful products in the world. So for example, I was the first female design engineer that Duncan Metering had ever hired in its 100-year history. And Thomas Duncan, who founded this company, was a famous inventor, right? And then I went on to, so if you go to any commercial building in the United States and you see a Siemens PT&D meter or a Landis+ Gyr meter, these are commercial meters. These are called smart meters. And I was the lead development engineer. And in the utility industry, nothing goes out without the lead development engineer's signature on the bottom line, right? So there's some amazing products out there that I was lucky to lead, including Dell Latitudes. There are tens of millions of people that use computers today that I was the lead planner on. So bottom line is, what I believe is that if you have a good set of skills, we need to take them to our government. Here's the challenge with the United States Congress today. The United States Congress doesn't have all the best skill sets, like you pointed out yourself, right? We talk about diversity in many different ways. We talk about gender diversity, we talk about ethnic diversity, but we also need diversity in expertise, people who can bring new ideas, new solutions. So what I say is this, look, we need people in Congress because the majority of us that get up every single day and work for a living, our country runs on our taxes. We need the most competent people there so they can use our dollars most effectively. So definitely, I think it's an edge. We won because we had the data. And I'll give you some proof points because I don't want you guys to say, look, Donna's just saying stuff, okay? In the primary, we had a rate of growth from 2018 of 233%, not 5, not 10, not 100, but 233. And in the runoff, okay, where there was no president at the top of the ticket, we had a 257% growth in the number of people that came out. And if you compare it to all the other Austin targeted districts, Democrat targeted districts, right? We had the highest rate of voter growth. Not only did we have historic voter, turnout in my district, we had the highest voter growth of all the Austin districts. And we did that. How? We did that because we understand this district, we know how to reach them, and we were able to reach our voters. And we did that with data analysis, with software engineers. We built our model, we went out, we targeted, and we got out the vote. So absolutely, I think it's an edge. And I think we're in a strong path to win it.
Hi, Donna. This is Tazida Ghaznavi, and I'm cheering for you from Arizona.
Awesome.
Thank you. You have a progressive platform. Please tell us about the key policies you're running on and how do these policies align with the needs of your constituents?
Yeah, that's a great question. So the core of our campaign is that we are addressing what is felt by Texans, which is economic anxiety. And this is something that not only Texans are feeling, but people across the United States. And I want to give you an example. What I like to say is this: if you get up in the morning and go to work, you might work 40, 50, 60 hours a week for years, sometimes decades. And if you get laid off from your job, all of a sudden you have absolutely no health insurance, which means if you get sick, you're challenged, okay? Now, a lot of you might be like, okay, what about COBRA payments? Yeah, you can only afford COBRA payments for so long. And you only get that if you work for a really good company that has that ability to give you that, right? And there are so many of us, it doesn't matter what you do for a living, whether you're in retail or whether you drive an Uber or whether you run your own business, right? You don't have the luxury of having coverage like that all the time. So we find ourselves, every single one of us, by the way, often finds ourselves in a situation where we don't know how we'll pay our rent or how we'll pay our mortgage, our car payments, and we don't have health insurance. And by the way, Texas has the most uninsured people in the entire country. So my platform is very simple. I'm running on healthcare coverage for every single person in our country, and I'm making a very bold statement that we can cover every single person in this country for much less than we pay today. And I am putting forth new ideas on not only how to lower the cost of healthcare even more, but also increase the quality of healthcare as we absorb the 80+ million people who have no health coverage today. So that is the core signature platform that I'm running on. On top of that, I am running on Education for All, which is a very important platform, especially for immigrants, because many immigrants, Bangladeshi Americans, may be first generation, or they may be immigrants to this country where they have education from some other university, and they may have language barriers. So they are trying to get maybe a certification, or they're trying to get a 2-year college degree or a master's degree, and you want to be able to graduate debt-free. You want to be able to graduate without a mortgage-sized loan to your name just because you went out. Concrete solutions on how to get education to every single one of our kids or anybody who wants it completely debt-free. So these are some of the key things that I'm running on. In addition to that, I want to mention one other thing that I'm running on is equal justice for all. And I'm extremely proud of this because we crafted equal justice for all in collaboration with various groups in our district, with various people in our district, to come up with the best solution for justice, for the justice system in our country. And there are some new ideas in there, including requiring law enforcement to carry liability insurance, for example, to prevent bad officers from being rehired even after they have challenges in their background or have been fired from their jobs. So yes, we're bringing new solutions. We're running on an economic platform. And I believe that these are solutions that will impact every single person across this country and definitely the people of my district.
Okay. So let's kind of lead off from there. Let's talk about a little bit deeper in the healthcare, as it is important to issue for all of us now, especially with this COVID and everything going on. America spends about $11,500 on healthcare per person, double the average of any developed countries, but we have shorter life expectancy by 2 years, higher burden of chronic medical condition, twice the obesity, and in general, less healthy than many. What will Donna Imam as Congresswoman do to address this complex issue affecting all of us?
Thank you. What a great question. So yes, that's definitely true. But I want to bring your attention to something even more simpler right now. So in this coronavirus pandemic, we saw Black Americans, Latino Americans being impacted disproportionate to the population that they represent. And one of the reasons that was cited by journalists and other scientists is that they have lots of underlying conditions. And the reason for that is we have more than 80 million people in our country that actually have no health coverage. And I'll explain a little bit further. There's a lot of people who have health insurance. So you can go get health insurance, and in order to bring down your premium, what you do is you get a high deductible. And what that means is until you satisfy that high deductible, and mostly it ranges in the $5,000 to $10,000 range, right? So until you spend $5,000 to $10,000 out of your pocket, your insurance does not kick in. So you get sick, and what happens? You don't go see a doctor because you don't have $200, $300 to go see a primary care physician or go to urgent care. So these underlying conditions build up over time. And what happens is when you have an emergency, what happens when you call your doctor, it says, if you have an emergency, call 911 or go to the emergency room. So we use the emergency room as our first line of defense, and that has got to change. And let me give you data to tell you what I believe is the solution. Number one, we have a huge lack of primary care physicians in our country. I am proposing that we do everything in our power to increase that. The reason that we have a lack of primary care physicians is because to go to medical school means you come out with a huge student loan. And even if you graduate and you practice primary care, the average starting salary of a primary care physician is around $120,000, give or take. Yet you have a mortgage-sized loan. So what doctors do is they tend to specialize to be able to pay off these loans, because specialization means they're able to earn a little bit more money. So we need to make sure that primary care physicians in our country graduate debt-free, period. We need to boost the number of primary care physicians, and that will lower the cost for every single person. It will focus healthcare on preventative care, and it will allow us to actually take care of ourselves and address these underlying issues that have built up over decades. So that's number one solution, which is very different from what any other politician actually across this entire country is talking about. Number two, I want to give you a second piece of data. In 2018, We spent $3.65 trillion on healthcare. All of us, we paid it, okay? Yet every single study says that if we have single payer healthcare for all, often commonly referred to as Medicare for all, that we would save at least $0.65 trillion. Every single study, including the Koch brothers study, who is a conservative think tank, there's a dozen of them out there, say that healthcare to cover every single person in this country should cost no more than $2 to $3 trillion. What I'm proposing is we can get the cost lower than $2 trillion and improve the quality of care, because we're not using emergency room, we're using preventative care, and we're using primary care and boosting primary care. Bottom line is, what I believe in healthcare needs to happen is that we're overpaying for healthcare while leaving out 80 million people, and that can be solved. And the last thing I will say is this: we as Americans pay for the entire world's prescription drugs. What does that mean? It means the drug that you buy in the United States is being sold for pennies on the dollar around the world. And you might be like, well, why is that? It's because the United States Congress has created a deal with big pharma in our country to be able to do that. Where else they go up the rest of the world, these drug prices are negotiated. Right now, if you have Medicare, if you are over 65, those of you who have Medicare, drug prices cannot be negotiated, and that is written into law, and that needs to change. So if we do these things, we can save a lot of money, and every single one of us should be getting money back in our pockets. And these are the things that I would like to take to Congress and highlight, because I think that they not only solve our current healthcare challenges, but they actually get to the root of the problem that we have in our country.
Okay. So I think so. I would like to actually follow up on your education for all. You mentioned that. So you talked about colleges and universities. I mean, our colleges and universities, whether private or public, stand out as among the best in the world. But we know that there is huge disparity between communities in the elementary to high school level. So how does your education for all actually address those disparities in performance and results?
So most of the K through 12 education is funded through, in most states, real estate taxes, by the way, in general. So there are some federal funds that come in that are distributed, but in most cases, it's a state level solution that we have today. But here's what we need. In our country today, we do not pay teachers well. So if you don't pay teachers well, you're not attracting the best talent. And this is a huge disservice to our children that are in public school systems. So number one, I would be a huge advocate to ensuring that we pay teachers better, because when we pay teachers better, we're going to attract some of the best talent in teaching. And this is going to improve the quality of education in a big way. Number two, over the years, the student to teacher ratio has increased significantly, which means you have more students in a room than you would normally have. So you're not getting as much attention. And that is also a result of basically cutting funds in K through 12 in many, many cases. Number three, we need to incentivize people coming into our teaching area with the ability to go and teach in underserved and rural areas that are not getting the best teachers, right? So one of the things they found is in rural areas, right, most people, once they go get educated, they don't come back to their own towns and cities because pay is low, right? You want to be able to, thrive. You want to go graduate and thrive. So you try to go to places where your income will be better. And so many teachers, they're doing a second job. They're teaching your kids and they have to do a second job just to be able to pay their bills. That's despicable. So imagine if you're doing two jobs. Are you going to come in with the freshest mind to teach the kids in the morning? You're going to be tired. You're going to be overworked, right? So number one, we absolutely need to increase teacher pay in a big way. We need to improve the quality of education in K through 12. And on the federal level, whatever I can do at the federal side, I would be a huge advocate of that, number one. Number two, I want you guys to know that my mom was a school teacher. okay? And I was a TA all through graduate school. And in fact, when I was an undergrad, I went to a really small engineering college, Trine University in Angola, Indiana, on the corner of Michigan, Ohio, and Indiana. And my professors created a TA job just so that I could have teaching experience because I was going to go to grad school. So I can tell you that teaching is extremely near and dear to me. And on top of that, the nonprofit that I led, that I was a president of before running for office, that nonprofit provides free training and education to anybody who wants it. So there's absolutely nothing more near and dear to me than making sure we improve the quality of education for our kids in K through 12, as well as trade school, as well as 2-year college and 4-year college.
Thank you. Donna, your policy proposals for important issues like healthcare and education are commendable. But let us change the subject to the more immediate priority at hand, which is getting elected. My next question is pertaining to that. What is the current state of your campaign? What edge do you have over your opponent?
Well, thank you. You know, you're absolutely right, Taz, that none of this matters if we don't make it to Congress, right? So I think we're on a winning path, and I think our campaign is doing amazing work, and I think we will flip this district. We're executing on everything we've wanted to. So here's where we are. First of all, as you know, we defeated 11 other Democrats to win this nomination. Now, many of these Democrats had ran district-wide. Some of them were even elected officials, and I'm a first-time candidate that is running for office and never ran before, right? And we defeated them. We got here because we executed on our plan, even though, even in the primary, we were outraised more than 2.5 times, okay, by my runoff opponent. But we won anyway, and we won big. We didn't win by a few votes. We won with a 13-point lead, and in Bell County, where we need to close the gap, we won with a 26-point lead, okay? That's massive. So my district has 2 counties. It has all of Williamson County and almost all of Bell County. And in Williamson County, in 2018, Williamson County already went Democrat. It went blue, okay? So Williamson County is all of Northwest Austin and the suburbs. So you heard of Round Rock. We also have Cedar Park. We have Leander, which has grown extensively. And then we have Georgetown. And you keep going north and you hit Bell County. Now, Bell County is where we need to close the gap, this 2.9% gap. And this is what I want you guys to know if you're watching this. This is not just a race where we're just running. When I was introduced earlier today, right, you guys said I'm in it to win it, because this race is winnable. It is only 2.9% for flipping blue. It's only 8,000 votes. And since November of 2018, we had more than 65,000 young people move into this district, young families with children. They tend to vote Democrat. And on top of that, many of them are very well educated because of the high-tech industry in Northwest Austin. We have Google, Amazon, Apple, Dell Technologies, VRBO. We have some of the big tech companies out here. So we have a really great opportunity in flipping this district. It's a close race. It's within the margin of error. So we can do it. So how are we doing? We're doing great. Our fundraising is looking great. I wish the money would come in a little bit faster. It would definitely put me at ease, but we're doing well. We are right now, if you donate to our campaign, every single penny will go to covering postage. So you get to help our campaign. You get to get more representation in Congress. And on top of that, you get to help the USPS, the United States Postal Service. We're spending a bulk of our money sending out mailers. And you may be asking, so Donna, why are you sending out mailers? Well, Texas is gerrymandered. That means they took Austin, they sliced it up, they appended it with huge swaths of rural land. And we need to reach voters in every corner of this district. And I don't know if you watched our show with Beto O'Rourke, who ran for Senate in 2018. But one of the things he said is, Donna, you don't care if someone is an independent, a Democrat, or Republican. You have reached out to every single person. And that is our winning strategy. We're taking our message, we're telling them that we can solve problems, and we're telling them that we can do it better than it's being done today. And we can save every single American your tax dollars, which you really, really work hard for. So it is important to every single person. So what are we doing? We are using mail. Mail is the most effective way, cost-effective way to reach voters. So that's how we're going to be spending your money if you donate to us. Now, we will be doing some TV advertising, digital advertising, and other means. We have road signs all over our district. So we are touching the voter in many, many different ways, including going door to door and leaving literature, including phone banking. So for example, if you wanted to help our campaign, you can phone bank for us from anywhere in the country. So, and for those of you who don't know, this is a federal race. So that means when you send somebody to the US Congress, they are legislating for you. They are speaking for you. Yes, I represent my district, but you're also sending somebody that when they make laws, when they legislate, that impacts you. So this is why if you are anywhere in the country, you can donate, you can volunteer, you can phone bank. And I think this race is ours to lose. I think we're on a winning streak. We need to get out the vote and we can win it.
Thank you, Donna. So this is going to be the last question of this panel discussion. So I know that you are seeing a lot of excitement, and we are also excited because, you know, it's unprecedented in the eve of a presidential election. We see our community coming together from every places and working hard. But here is the fact, though, you know, the Asian American people, including our community, you know, we have a record of turning out less than 50% to vote. And that is a sad statistics, not only nationwide, and I think, you know, it's also true in Texas. So what would you tell to our people, not only in your district or in Texas, but nationwide to our community, that, you know, the people don't have a good, strong record of going to vote? That why this is important in 2020, and what is your advice to them?
My advice is really simple. You know, I am not a politician. I have a background in engineering, and I have never dreamed of running for office, and I have never intended to, right? But when I sit in front of the TV and watch what is happening in our country with respect to how our funds are being used, where we are fighting endless wars around the world with our taxpayer dollars, while we have veterans begging outside our grocery stores here in Texas, I felt a compelling reason to get up and do something about it. And know this, that the way you live, where you can live, how you can live, the education that you can get, the cost of your rent, your mortgage, every single thing, every single dollar you pay, the quality of your life. When you say life, liberty, and the pursuit of happiness, that depends on your legislators. And if we don't put the people that really represent us, that are going to work hard for us to do the things that we need for our lives, we're not going to get it. You're not going to get change, and you're not going to get the life that you want, the livelihood that you want, unless we get up and vote and put the right people in office. And there's absolutely no doubt in my mind that right now we have a Congress that is completely driven by corporations and lots of financial interests. We see Congress members being, you know, influenced by lobbyists who are writing legislation. These lobbyists don't represent you. They're not the ones who are looking out for your day-to-day life. They're not looking out for the future of your children. So if there's one reason to vote, it is to come out and find out who are the people fighting for you, who are the ones that are doing the work for us, for our lives, to make a better future for our kids. Those are the people that we want in office, and we're not going to get them in office if we don't come out and vote. And a lot of people don't vote in primaries, but if you don't vote in primaries, then you just get any Democrat or any Republican, whatever that may be. I don't care what your party is. Come out and vote for the person that's going to work for you, and the only way that happens is to vote. And you're not going to get change by sitting in front of the TV and being upset, but you are going to get change if you do your research and come out and vote. So it's important. It impacts your daily life. If you want to forget everything else that happened today, I want to tell you that the person who represents you will impact what happens to you tomorrow, a day from tomorrow, a week from tomorrow, a year from tomorrow. They are creating your future. Don't let them do it without you having a say in it.
Thank you. Absolutely. That's the passionate appeal to our folks, so that, we turn out and we ignore all those, everything that we see, including the fear of COVID, and then, take some, safe approach to vote in person, vote early, everyone all over the country. So this and our panel discussion from the panel on the Zoom, and next segment is even more interesting. I don't know if you know, Donna, that your candidacy is creating a lot of excitement, everywhere in the country, and a lot of our young people from different part of the country are watching your campaign, and they want to know about you more, and four of them are here tonight, and to ask some question to you. So I'll go to each of them one by one. So, folks, you introduce please yourself and then ask your question. So the first question goes to Anila Ehsan.
Hi,
Welcome,
Donna.
Anila.
My name is Anila Isan, and I'm a freshman at Northeastern University in Boston. And my question to you is, what advice do you have for young people who are also trying to break into spaces that conventionally have not been welcome to people who look like them?
Thank you so much for that question. I'm really excited that you're on this Zoom call with me. Really awesome to see you here, and that you found out about our campaign. So thanks for joining. So what I always say is, look, if you're really good at what you do, then no one can hold you back, because every single person is looking for, every company out there, every field is looking for the most competent people, right? So the best way to break into areas that have normally not been open to you is to get the skills that you need to, really make an impact in that area, and no one can hold you back. Now, I know that's not an easy mandate. It's not easy just to say, go do it, but every single one of us has the ability to, do our research, try our best at finding out what is required to break in, and then go be really good at it. And what I would say to anybody, by the way, whatever you're trying to pursue, there are 3 skills that I think are invaluable, no matter what field you're trying to get into. One, having really great communication skills, both verbal and written. It will get you far. It doesn't matter what your field of expertise is. And number 2, if you have the ability to get research and analytical skills, because our economy is more and more technical in nature, and having good research and analytical skills will definitely put you in the top, half of the talent. And so if you are better than average, and if you're at the very top, it's going to be very difficult to stop you from succeeding.
Thank you. Next question goes to Shabab Hussain.
Hi, Donna. How's it going? My name is Shabab Hussain. I'm a second-year medical student at T2HSC School of Medicine, and I have a question regarding your healthcare policies. Healthcare is about 20% of the American economy, with 4 key components: access, cost, provider choice, and quality of care. And while most people agree on access and cost, there are significant disagreements on provider choice and quality of care. So given that our country follows a capitalist framework and an arguably harmful, rugged individualist attitude, how and why do you think the one-size-fits-all policy of healthcare for all, or Medicare for all, is the right solution that will improve healthcare and be accepted by the people as a whole?
Yeah, great question. So first of all, healthcare for all is not a one-size-fits-all at all. In fact, it is the most flexible healthcare plan that anyone can come up with. There's a lot of misconceptions about single-payer healthcare. So when I talk about single-payer healthcare and Medicare for all, a lot of people tell me, oh, so this is the UK system, or this is the Canadian system. And the answer is no, no, and no. It is not the UK system. It is not the Canadian system. It is not the Australian system. It is a true American system. What single-payer healthcare does is it keeps every single provider, that means small, primary care physician who wants to run their own practice, to hospitals, completely private. All it does is changes from hundreds of payers and tens of health insurance companies. You're pooling all that money into one big wallet. What happens when you have one big wallet? You have more ability to negotiate. You have more ability to negotiate with multiple providers. right now, you have the most inflexible healthcare system in our country. And I'll give you a very simple, example. You can only go to in-network doctors for your health insurance coverage to apply. If you go to out-of-network, you're either going to have to pay a ton of money or it's not going to be covered at all. So you actually don't have access or ability to go to the doctor of your choice. You are limited. With single-payer healthcare for all, you would be able to go to any doctor of your choice, anywhere in your city, in your state, in your country. So it's the most flexible way to actually get healthcare coverage, number one. Number two, healthcare for all covers every single person in our country. So there's a lot of people out there who are like, yeah, but you know what? I don't want to pay for those people, and I don't want to pay for these people. Here's the fact. Here's a fact. You are paying for every single person that goes to get healthcare. When you have someone who is 20 years old and is healthy and decides, I'm not going to have health insurance coverage, and they go skiing with their friends and they break their leg, okay? And then they go to the hospital. Guess what? The hospital sees them and they fix that leg. And if they, file bankruptcy or are unable to pay that because whatever, somebody picks up that bill, and that somebody is every single one of us. That is why every single year, year over year, our premiums are going up, our deductibles are going up, and our healthcare quality is not improving. And I'll give you one last example right here in Austin, Texas. If you have Affordable Care Act in Austin, Texas, you have very limited opportunities. You have something like 2, maybe 3 health insurance companies, and most of them do not cover the physician or the surgeon that you want to see. And I'll give you a really quick example. A friend of mine just had knee surgery, and her surgeon said, I'm in network, but I have no idea if the surgical assistant is in network or if your anesthesiologist is in network. And by the way, it doesn't matter. You've got to use them anyway. That was the answer she got. So bottom line is healthcare for all solves all of these problems. And by my healthcare for all policy that I'm proposing builds on Medicare for all, improves Medicare for all, lowers the cost further, and improves the quality of care. There is no other plan out there that does all these 3 things. And we have a huge network of ER doctors right here in Central Texas that are supporting this care, because ER doctors, guess what? They encounter people without health insurance every single day. Because what happens when you don't have health insurance and you have an emergency? You go to the ER. So they see this pain on a day-to-day basis. So thank you so much. And I hope you have a really great career ahead of you, and that you will be compassionate as you become a doctor, and we'll be really proud of you. Thanks for asking that question.
Thank you and good luck.
Thank you, Shabab. The next question goes to Farnaz Ahmad.
Hi, Donna. I'm a sophomore at the University of Connecticut. I hope you're doing well. I have a question regarding gun violence in our society. We have witnessed a high number of mass shootings in schools in recent years. So I was wondering, what are your ideas about some common sense gun laws that the Congress can enact so that our students don't have to risk their lives to get an education?
Yeah, so we've all heard of universal background checks. So universal background checks across this country are supported by over 97% of the American population, or registered voters, or voters, however you want to call it, including gun owners and NRA members, okay? It is an absolute no-brainer not to have universal background checks and close the loopholes that exist for gun shows. So that would be number one that I'm a huge advocate of, and we need to get that passed through Congress immediately. It is required, everybody's on board, there's no reason not to do it. Number two, what a lot of people don't realize is that most of the gun deaths in our country actually happen from semi-automatic handguns. So I actually have a proposal for registration and training, which you would be able to monitor at the point of sale whether a person is and should have that weapon. And this is something on top of universal background checks that I believe that we should enact. These 2 things would cut down gun violence and deaths from gun violence in a significant way. 64% of gun violence happens from handguns. By the way, majority of actual deaths from shootings are from people committing suicide. So we need to address mental health. And we just talked about healthcare for all. Mental health care coverage would be fully covered with healthcare for all. And I think that is an extremely, extremely important component of solving the gun violence crisis that we have in our country.
Thank you, Farnaz. And the last question from the young people is Riham Chaudhary.
Hi, Donna. My name is Riham Chaudhary, and I'm a senior at Dartmouth College in New Hampshire. And I had a question about the job market. So in the face of COVID-19, the economy has taken quite a huge hit, as well as the job market. And I was wondering what sorts of policies do you plan to propose to help jumpstart the economy and, promote job growth?
Yeah, absolutely. In fact, I've heard so many young people tell me that it's been so difficult to find a job, especially since March, right? One of the challenges that we've had through coronavirus, I think that our leadership really, really mishandled coronavirus, because at the very beginning, they knew how infectious this disease was, right? They knew how, it could be really, really addressed. We saw Asians with various types of, pandemics in the past, where wearing masks, for example, could have really, really cut down on the number of people that got sick. So they didn't take advantage of the shutdown that happened, even though it was sporadic around the country. Many areas of the United States had shutdowns. During the shutdown, we could have done multiple things. One, we could have ramped up testing in a really big way. Number two, we could have mandated mask wearing. And by the way, I'll give you an example for those of you, who may be on the fence with that. In Texas, we had spiking cases and overwhelming number of people in hospitals, overwhelming the hospital systems here, the ICUs. And then finally, the governor broke down, and instead of making the retail stores and the businesses police mask wearing, he mandated mask wearing. And as soon as he did that, within weeks, we saw a downturn in the number of cases and the number of people that were in hospitals. So yes, cases were still spiking, but we had fewer people in hospitals. So here's what happened in the CARES Act. The United States government took a $6,000 plus loan on every man, woman, and child in this country. Many people don't know this. They've taken a loan on you and your kids. And most of that money did not go directly to people. So I would have advocated for most of that money, if not all of it, to go directly to people and small businesses during that shutdown, and we could have opened up really quickly. So that was a big challenge. Number two, what they did do is they gave a stimulus, they gave some unemployment, but then they cut that unemployment in half. And right now there's an executive order, but it's very difficult to live on such little money in this country. So these are huge challenges. Now you ask me, what would I do? Okay. What I would do right now is that we absolutely need to be very smart about how we open up. Just saying, let's open up, all of our businesses is not going to help you grow, because here's what's happening. You can open a restaurant, but if people don't come in and sit and eat and feel safe and they stop getting sick, you're not going to be able to open up, restaurants and movie theaters and so on and grow the economy. So we still need to ramp up testing in a really big way. We still need to make sure that every single one of us at all times is wearing a mask. And by the way, that is not happening. There are people still having parties. You guys are all on college campuses, right? There are people having parties with no masks. There are all kinds of social events going on. I still see Facebook posts where people are not wearing masks. Bottom line is, we have to take this seriously. We have to wear masks. But we can use this now to invest in sectors that have never been invested in before, right? In the energy sector, there's so much growth that we can do. In the automation sector, there's so much growth we can do. I'm also an advocate for, UBI. And I think that profits from automation should pay for UBI. So that, and what happens when you have that? When you have that little sense of economic security, now you're an entrepreneur. Now you're creating new products and services from your dorm room or your parents' garage, right? We are going to see a huge growth in entrepreneurship, new products and services, innovation in our country. And I think that if we can help people get through this pandemic in a safe way, and they can trust, they can trust their leadership, they can trust what's happening, because what's happened is we have ruined trust. Because at the end of the day, the saddest part of what's happened in our country is that over 200,000 families have had to have a funeral in the last 7 months. And that is tragic. Many of them could not even say goodbye to their friends and family. And in New York City, when it first started out in March, many of them were Bangladeshi Americans that died in New York City. And this is something that we need to take seriously, but we can address it. We have the smartest people in our country. We have the best technologists. We have the best scientists, and we can grow our economy. And we need to invest in it, and we need to do it smart. There's still time to do it. But if we keep denying science, then we won't get there, and this will prolong. So we need Congress to act, and we need to do it in a smart way. I hope that helps.
Thank you, Donna. So I promised to end this within an hour, but we also have a few questions from the audience. So if you allow me, we'll ask them, and you can choose to answer them briefly, at least a handful of questions, if that's okay with you.
Okay.
Thank you.
So I have a question from Muhammad Ibrahim Faisal from Arizona. And this is how it goes. The hypocrites in Republican leadership are on their way to replace RBG. Going forward, a lot of issues that are near and dear to us as ACA, education, environment, civil rights, likely to be litigated and probably will be decided by the court. What are the Democrats specifically planning to do that to counter that?
Yeah, what a great question. Right now, there's all kinds of talk, but I think one of the biggest challenges that we are facing right now is that we needed the 60 vote cloture, and we needed to really protect that. And unfortunately, we did not do that. So if Judge Amy Coney Barrett is actually confirmed, we will have 3 judges that did not meet the 60 vote cloture threshold. And I think we are watching the destruction of our democracy and the destruction of the Supreme Court of the United States, which is, I think, a grave challenge. I think one of the biggest things that Democrats can do, for example, in Texas, right? All of you that are outside of Texas, you see Texas and you're like, that's a red state. But what's happening in Texas is most people do not feel that their vote counts. So they don't vote. More than 50% of the people in Texas don't vote. In my district alone, we have something close to, give or take, 568,000 registered voters, but yet more than 200,000 of them, and it could be close to 250,000, people have never voted in this district. Never. Think about that. They're registered voters that have never voted. So now we see the impact of not voting, right? We don't have the power in the Senate to be able to legislate and to be able to bring the right Supreme Court justices. And I think Democrats need to learn from this. They need to learn that it is important for us to participate in our democracy, to come out and vote, because this is what happens when we don't. And I think we need to do a better job of it and really inform people. Half the battle of running for office is, can you inform people, and can you inform people effectively? And we are up against a huge, monstrous machine, which is the mainstream media has an agenda. You have to understand that they are owned by corporations, that they need to sell TV ads and newspaper ads and digital ads, right? That is their main focus. So it is really important for us to be able to educate. And this is where you guys come in. Every single one of you needs to go talk. We need to take back the Senate. Democrats want to have influence. We have to take back the Senate. We need to put good judges in the Supreme Court, and we need to take our vote seriously. So that's what I would say, and I think we need to do a better job of it, for sure.
I will ask, actually, 2 persons asked a similar question regarding your campaign. One is Rubina Naz from California, and another is Aisha Murshid. So basically, they want to know how are you going to engage your undecided voters, and how are you going to close the gap of 8,000 voters?
That's an awesome question. Thank you so much for that question. So we have two counties in my district, Williamson County and Bell County. And almost, 95% more than that of Bell County is in my district. In 2018, Williamson County already went blue, so the gap is in Bell County. We are talking to economic challenges that Bell County faces. So if you're an undecided voter, if you're an independent voter, you are going to care about these issues that we're talking about and the solutions that we are bringing forth. So for example, in Bell County, people don't have high wage jobs. Many of them, in fact, majority of them are limited to less than $10 an hour retail jobs or service jobs. They don't have any health insurance coverage. We are talking about bringing solutions of healthcare coverage. These things are moving these voters in a big way. We're also engaging voters that have never been asked for their vote. Bell County is a majority minority district. What that means is 50% or more of Bell County is Black Americans, Hispanic Americans, Latino Americans, and Asian Americans. By the way, Asian Americans are the fastest growing population in Texas by percentage. It's still as small as a whole number, but it's a huge growing percentage in Texas. We're engaging with these voters and we're addressing the challenges that they are facing. Number two, there's some polling out there, by the way, done by a third party that says that our campaign has enormous favorability with independents. And the reason it has this favorability that I believe is that we are communicating in language that voters understand. Look, voters understand being able to go see a doctor. They don't care how it came to them. They don't care if it's ACA or Medicare for all. They want to be able to see a doctor when they get sick. I'm saying that healthcare for all is the most fiscally astute and smart way to bring that solution. Voters understand paying rent, being able to afford their mortgage. And I'm saying we need to bring high wage jobs to Bell County, and they get that. Voters understand graduating debt-free. They get the fact that if you have a huge debt after you graduate, right, you can't live comfortably. So when we say we're bringing debt-free education, whether it's trade school, whether it's 2-year college, 4-year college, they get that. We are communicating in terms that they understand, and that's how we're winning undecided voters over independents, moderates, and we're uniting the electorate, and we're going to get this done.
You have time for a couple other questions, or?
Okay, I think maybe we can squeeze in one more if we want. Yeah, so this is from Mahmoud Hassan from North Carolina. Maybe too broad question, but see if we can address it quickly. We know Democrats got a unified control in 2008, but lost in 2010, hoping they will get another majority in US House and Senate. Think Democrats should take on 2021.
We need to solve healthcare for every single person. Healthcare is a huge problem. Look, I'm an engineer. I work in the high-tech industry, and I have many friends and coworkers who work in the business sector or they're engineers. And if I talk to them about their health insurance, every single one of them says, I hate my health insurance. And you know why they hate it? Even though their deductible is tiny, maybe it's $3,000, they're like, I can't go to the doctor that I want to. And by the way, that deductible resets every year, by the way, in December, right? So I have friends that need surgery in November and they wait all the way through to go to January to make sure that they don't pay their deductible twice. That system is silly. It's ridiculous. It impacts all of us. Even if we have good jobs, if you lose your job, you don't have health insurance. You can't go see a doctor. It's ridiculous. And this is draining our economy. This is a huge burden on our economy. And these health insurance companies, the billions, the hundreds of billions of dollars that they're making, they're not even in our country. They're sitting in the Cayman Islands, okay? That's where they're stashing their profits. They're not paying their taxes, and that's got to change. This is a huge problem for our country. And if you've ever had to go to a doctor or get surgery, it is a problem every single time. You go in and you're like, okay, this guy's in network, that's not. You can't get this test done, but you can get this test done. You can't get this medication because your health insurance company won't approve it. You have to pay out of pocket. This is ridiculous. It's got to stop. I think Democrats really need to solve healthcare once and for all, and we have a really good plan to do it.
So I think that wraps up our event tonight, and thank you so much, Donna, for being here tonight, and also for the last 10 minutes for being flexible. I know your time is very precious at this moment, so I really appreciate it. Thank you, colleagues, for asking some engaging questions, and thanks to Shabab, Riham, Anila, and Farnaz, and thank you, the viewers who have been watching live. Please keep watching. We have a similar event in next week. I think we have a fundraiser with Nina Ahmed, so please join us this time next week. And those who have not had a chance to donate to Donna's campaign, so the link is still there, will remain there for next couple of days. I know that, in a couple of days, we get about 3,000 to 4,000 viewers of our videos or the event. So, please pay attention and help Donna as much as possible. Thank you, everybody. Good night.
Good night. Thank you, Donna, and good luck.
Thank you.
Thank you so much for having me. I really appreciate it. And really great to meet all of you through Zoom.
Thank you. Wish you good luck.
Thank you.